I mean, all of you, I'm sure, are aware of what is seen on a daily basis there. But what it pointed to is the importance of ensuring that as we go forward as a country and as a party that is in waiting to be government, that we are mindful of the issues that are critical to the community. The Cornwall Regional doesn't only serve St. James, it serves the western region, it serves the entire island. In fact, when we went to the Type 5 clinic, we learned that people come from as far as Ulteriors to the Type 5 clinic here in Montego Bay. So access to health at the primary level and secondary level is absolutely critical. And we right now in this parish are feeling the effects of not having a hospital, a fully functioning hospital, accessible to all of us. As many of you know, or you should all know by now, I am running to be the Member of Parliament in the constituency of St. James Central. And it is important, wherever I go, I remind all of us of why I am doing what I'm doing. I want to invite Councillor Thomas to join us up here. He was also on the tour with us. I entered the race because I believe it is important for quality representation that listens to the people, and a representative who responds to the people. And whether it is in Rose Heights, Farm Heights, downtown, whether it is in Green Pond, Cornwall Court, Portobello, the issues are consistent. Access to housing, access to affordable housing, access to education, access to community recreational spaces, access to basic infrastructure that it should be normal and expected, but nowadays, because it's so few and far between, it is celebrated when it's provided. And it should not be celebrated because road, water, and light is a requirement, a basic requirement. So ladies and gentlemen, this evening's activity, this event, it won't have a lot of talking from me necessarily, although I will wrap up at the end. I want to focus on health care and also to hear your concerns and what you want us to bear in mind when we form government. Because this is what it's about, dialogue with the people to make the best policies for the people. So I want to welcome you all and thank you for participating. Thank you for coming out, especially on short notice, and for engaging with us as we put our plans together when we form government. All right? So thank you very much. I'd like to ask the councillor, never mind is the councillor for the other side of the room, but he is the Mount Salem.
Good evening, everyone. Good evening. How are you doing? It's good to see you all here. It's great to see you in the audience here. The mission today is not about me speaking, it's about Senator Allen and Dr. Dawes, who are here. One, seeking to represent the people locally and is ensuring that all the issues are ventilated all over, because the truth is your voice is your representative here in St. James, and that's why all of these town hall meetings is trying to get from everyone. So it's Janice, it's Andre, it's Raymond, it's Alan, it's Nikisha Burchell. It's to put that PAP strength that we need here in St. James on proper representation. And the proper representation is required right here in Mount Salem. How many of you know of Zoso? All you know about Zoso? How many of you want Zoso leave tomorrow? Yeah? I don't want to leave. You don't want to leave. Right? For various different reasons. But it's not about making Zoso leave. It's about providing security. It's about providing proper health care. It's It's about going home in peace. It's about knowing that if you feel sick, you have a health center that you can confidently go to. But that's not for me to speak about. I don't know Dr. Dawes to tell you about the plans for those. It's all about it. It's about a standard of living. A standard of living that the People's National Party have in its vision for all the people, the average person. So, congratulations, Senator Allen for having this forum, and congratulations to Dr. Dawes for taking the time out to come, look at the health facility, talk to the people, understand it, because we can't make policies if we don't understand what is happening. So sometimes these stores we have to understand. We can't wait until we take government, which we will, to go and figure out how it is happening. We have to know it from now, discuss the policies, put the plans in place, so that leadership becomes much, much easier when the time comes. And that is the preparation we are doing for, because the highway route we can't continue.
Simply put, Harry, ladies and gentlemen, it's very rare that we have a meeting like this that it is necessary to do any introductions. Many of us know Dr. Dawes from his days in Western Jamaica as the CMO at Salem Hospital. He's no stranger to healthcare provision of service in this parish, in this region. And he has gone national with his work to the point where he's now seeking to be the Member of Parliament for St. Catherine South East. Dr. Dawes is from a family that is well known in the People's National Party. His medical expertise is also becoming even more well known for all that he has done. He continues to write in the paper, he's very vocal. And every day you turn on whether the radio or the television, he's speaking about, Dr. Dawes is there, advocating for greater access to, that's right, for greater access to healthcare. And he will tell you he's not about ribbon cutting, he's about the provision of service and the maintenance of our healthcare facilities so that you and I can access it. I want you to welcome Dr. Dawes, and I want to thank you very much for journeying, especially you were in Portland yesterday, and you came to Montego Bay, you were here before 9 o'clock this morning, and then you're going back to Kingston tonight. You deserve a medal just for today alone. So welcome, Dr. Dawes.
Thank you, Senator Allen. Also, good evening, everyone.
Good evening.
Let me start first by giving a little personal experience. Recently, I had a little health issue, and it reminded me that you may have 100 problems keeping you up at night. At any point in time, right now you're thinking about bills, school, problems at home, road, whatever it is. But when you have a health problem, you have one problem. Everything else fades away. And it just shows you how important health is, but how little attention we pay to it. When you look at what the polls say, they say that Jamaicans are more concerned during this election season with roads and water and the economy and overall jobs. But the fact of the matter is that not everybody drive a car to be worried about pothole and front end parts and the cost of them. Not everybody has kids, so their education may not be a priority for them. But every single one of us will get sick at some point in time. And when we do get sick, what quality of care are we going to get? Even if we're living an arty, we have somebody who has been a victim, and I call it a victim of the public health system. Because even when you go there and you get better, you don't feel good because of the conditions in which you have received that care. We talk about basic dignity.
but we have to talk about humanity as well when we're accessing these healthcare services. So, when we are looking to form the government, we are looking to fix the healthcare sector, but it requires a push from the people. You have to demand better healthcare, because I can tell you, there are some powers out there who are benefiting from the broken system.
Yes.
And they are not going to sit by and allow the reforms to take place. There are many issues that are low-hanging fruit. There are many issues that are systemic challenges. The problem we are having is that this government, they are more concerned with prettying things up rather than fixing the actual system. So there's a lot of public relations, a lot of marketing. You'll see a lot of billboards around the place talking about the Ministry of Health and Wellness and you must do this and that. You'll hear that if you realize the outside of Cornwall paint up pretty long ago, while inside is a shell. No, that is a straight public relations strategy to let you think that something is going on. When nothing at all was happening, they were still demolishing inside. We see a lot of groundbreakings where there are announcements of clinics being upgraded, but the services are getting poorer and poorer. Recently, I did a tour of Montego Bay Hospital, and when Montego Bay Hospital was recently upgraded from a Type C hospital to a Type B hospital. Now, when I asked about the services that patients are getting when they go there, I was shocked. Because Montego Bay Hospital used to be one of the hospitals in Jamaica where, if you want to learn laparoscopic surgery, which is my specialty, keyhole surgery, they bore some holes and they go home the same day. And Montego Bay Hospital was the mecca. That was where young surgeons went to get those surgeries, to get some hands-on and exposure. You had medical missions coming from overseas, and they would do many gallbladder surgeries, many laparoscopic surgeries. And when I went there, Montego Bay Hospital did not have one consultant surgeon. The whole surgery system was shut down and everybody was being transferred to St. Anne's Bay Hospital. It was an absolute disgrace. So when people come and they see the nicely painted, refurbished hospital and they are not getting services that they used to get a year ago, it is an indictment on the healthcare system. A week later, the Minister of Health was there touring the refurbished pediatric ward and speaking about the developments at the hospital. And that is their PR strategy. They just speak about infrastructural developments while the people suffer. No matter how pretty a waiting room is, if you cannot get a bed when you get admitted, the system has failed. If you get a stroke, and 7,000 Jamaicans will get a stroke this year. 7,000. When they get a stroke, they're going to be in hospital. They cannot get a CT scan because even at Cornwall Regional here, it is an absolute embarrassment that you have a CT scan, brand new, and it does not have a battery. So you cannot use it. The UPS is not working, so the CT scan is sitting there in a nicely refurbished room, and if you want a CT scan, you have to go outside and pay money to get it done. Cancer patients were bawling recently because of the cost associated with the repeated scans that they have to get. So you get a stroke, you come in, you cannot get a scan. You are there for days at times. And then it's no doubt that by the time you can diagnose what is going on in the brain, it is too late for the doctors to do anything. You have many motor vehicle accident victims in hospital awaiting surgery. It is so bad that the bones heal in a deformed manner. So by the time the surgeons get to them, and you have to buy your own plate and screws and all the instruments and rent the drill that are needed, the system is not providing that. So you better find a way to set up a prescription. With free healthcare, you get what you pay for. Nothing. So you are there, your bone is healed in a normal fashion, and by the time the surgeon goes in, they have to break back that bone in order to set the bone properly. The surgery takes longer, you have to increase risk of infection, complications, and unfortunately, for many elderly patients with hip fractures and so on, they are in hospital so long that they get pneumonia and die. So it's a warning to any elderly, especially females, be careful, because if you get a hip fracture, it could be a death sentence for you here in Jamaica. And I'm not being alarmist. It is a reality that we face. So we're seeing a broken system where you cannot diagnose properly. Even if you have an extended opening hours at the Type 5 Health Center, they draw the blood, they send it to the hospital. They cannot diagnose, so you still have to go to the hospital. So the question is then, why bother to go to the health center if you cannot get diagnosed and treated? So people are still going to the A&E department, and the A&E department as a result is overcrowded. When you look at the clinics, access to care is such that on some days you don't have a doctor. In some instances you don't have medication there. True. And then of course, again, it goes back to if you need an x-ray, when the x-rays are broken down, where do you go? So you cannot afford to get sick in Jamaica. You cannot afford to have a fall. You cannot afford to be in an accident, because you have to find money to get everything done privately. And that is what we have to change. And unless health is a priority for you to say yes, when you go into the Ministry of Health, we are demanding that you make the necessary changes, then the pressure, the lobbies, and those who want the system to remain broken, they will win without your outcry. And it is more of an appeal that I am making here today, that you make it a priority to demand better health care for you and your loved ones. When we speak about reforms, and there's a lot of debate about what we are going to do when we are in government, and some people say that you should not share your plans because they will steal it. True. Well, let me declare unequivocally, my plans are non-partisan. And if they steal the plans, they can give me credit, but as long as the Jamaican people benefit, I sleep on that night. The problem is that they cannot implement. They are more in putting a lipstick on a pig than getting anything actually done. Reforms are going to be very boring, very tedious. It's going to be a lot of laws being written, a lot of laws being passed. It's not any ribbon cutting. And we know they love to cut ribbons. I don't know what they have against ribbons. By the time the election is done, there will not be one unbroken ground in Jamaica, because even when ground was broken already, they are breaking ground again. It is all about lights, camera, action for them. They had a health fair recently, and they had a ribbon cutting, not a job fair. And for the first time in my life, I saw a job fair open with the Prime Minister cutting ribbon. Nowhere in the world have you ever seen a job fair being opened with ribbon cutting. And they had a lot of people lining up in the hot sun to drop off resume. And quite frankly, the entire job fair could have been an email. Yes. Because you could have sent in your email and end up a callback. But it was a spectacular production with influencers and entertainment and TV media coverage, and it looked good that the government is doing something about the staffing issues. Yeah. But the boring way to fix staffing is to train more people, incentivize people to go to areas where there are shortages, and to stop the outflow of staff members from going overseas where they have more lucrative job offers. We cannot pay to compete with a UK or Bermuda or Bahamas or the US and so on. So we have to find a reason for Jamaicans to stay. So incentives, whether it is housing, and there are discussions taking place with the future Minister of Housing, Senator Floyd Morris, to see how can we capture the young graduates, the young nurse who is ambitious. How can we get her a key in her hand to say, this is my starter home and I am going to build. And how I'm going to build is I'm going to stay here, develop my healthcare sector, while at the same time building my own personal network through this house and achieve the Jamaican dream. These are the things that we have to look at. We have to look at training opportunities. Everybody has ambition. Everybody wants to be a little bit better. Try and realize their true potential. But there are too many young people who are frustrated because there are not enough training opportunities available for them. They are stuck at a level and they just have to wait until somebody dies to move up. We want to incentivize training, and not just incentivize training for people to stay, but use training to incentivize people to go into underserved areas. So you may not have this problem now where a lot of doctors would want to stay in an urban center. You are an urban center. But when you look at Port Antonio Hospital, that is the only hospital in the parish, but they have only 12 doctors. But yet, just across the border, you have Princess Margaret Hospital, which they have they call it a highway, but I mean, I don't know if you can call it a highway really, but at least a little bit closer to Kingston. They have 30 doctors. Now what we want to do is to say to the young doctors and nurses, if you go to one of these hospitals that are under-resourced and do a tour of duty, do a 6 months, do a 1 year, we are going to bump you up on the priority list to get into a postgraduate program and train. And that is how you're going to attract the brightest and the most ambitious of the youngsters to go into these underserved parishes to give them the service that people need and are so desperately wanting right now. So I cannot put a ribbon for a program like that. So when we are talking about the reform of healthcare, it is going to be a lot of these policies that you will not see on TV, but then the people will feel it when they go to the centers of excellence that we hope to create by democratizing staff and services across the different regions. We also want to look at how the equipment are maintained. It is a disgrace to see what Cornwall came to. What is worse is that when you go and you see that Cornwall is a shell now, 9 years, 8 years after they closed it down for some repairs that would have cost $3 billion. Well, move from 3 billion to 25 billion. No, and this is billion. And a lot of people don't understand how much a billion is. 8 million is a lot of money, right?
Yeah.
Enough money. Can change your life right now if I give you $8 million.
Of course.
Every day, $8 million is spent on Cornwall Regional Hospital according to that budget. Every single day, if you look at from the time when they are shut down to where they are now, to going for completion, $8 million a day. That is what taxpayers are forking out. That's me and you, everybody here.
Yes.
Now when you look at what $8 million a day could have done for the rest of the healthcare sector, what could it have done to your clinic? What could it have done to typhoid? What could it have done to get medication subsidized at private pharmacies? What could it do to get CT scans, X-rays, ultrasounds right across Jamaica? This is what people don't appreciate. The level of mismanagement and, dare I say, outright theft that has robbed us, not just of proper care, but the human lives that have been lost waiting for that medical care. They are gone, and they're going to say that they were sick by, they were too far gone or something like that. And that is why they died. Nobody will ever say it is a systematic failure that led to their deaths. So we have to look at how we're going to fix equipment, maintain equipment. There's a lot of talk about privatizing and outsourcing maintenance right now. I am not against public-private partnerships. Let me state that categorically. What I am against is the wanton use of public funds to enrich people who are preying on the system. And that is what is happening in too many instances. Senator Lambert Brown raised an issue the other day in the Senate where a drill was purchased at Bustamante Hospital, and the market value for that drill was $5 million. The drill was purchased for $30 million. These are the things that I have an issue with when you're talking about procurement and how we purchase from the private market and the relationships that we get into with the private market. For maintenance, there used to be a unit called the HFMU that was responsible for maintaining the different hospitals, whether it's the roofs, the bathrooms, the equipment, everything maintenance in the public health system. And they used to make sure that the CAT scans are working, the ultrasounds are working, the X-ray machines are working, and the roofs weren't leaking. They basically shut down that unit, and now they want to outsource it, where you will be paying at market rates, something that could have been done by government workers at lower rates. We want to reform and bring back maintenance into the public healthcare system under the Ministry of Health with and that is going to be a priority for the next administration. So I don't want to stay here all night and just speak, because believe me, I could go on and on. But I know you have some burning questions.
Indeed.
But just to summarize, we want to look. We're going to shift focus from this priority of just infrastructural development and neglecting services to focusing on services now, so that when you are sick and you go to the clinic or hospital, you will be treated and get better.
Yes.
That is what we are going to prioritize when I'm the Minister of Health. And to do so, we're going to look at the equipment, the maintenance of the equipment, and the staffing right across Jamaica. And that is the short version, the executive summary of what we intend to do to fix healthcare in Jamaica. But I end again by asking you, you need to demand it.
Yes.
Without health being a priority in this general election, it is going to be the same road and water, all of those promises, and they'll just patch some roads and say, yes, you got a road. Or they'll pay off people $5,000 wrapped up in a t-shirt. And that $5,000 has to be divided over the next election cycle, so $1,000 a year. We have to demand it, because it is us and our family who are going to be in danger if we don't have wholesale healthcare reform. I thank you.
Thank you very much, Dr. Dawes, for those very bold positions, incentivizing training and incentivizing people to stay in Jamaica, to build Jamaica and the Jamaican dream. I'm happy you mentioned that, Alfred, because very often we hear of the American dream and we know what that is defined as. It is time we define the Jamaican dream. And the Jamaican dream includes having a place to call a home. Whether the home is in the urban center, like in King Street or Hart Street or Barks Road, where we must incentivize developers to develop housing solutions in the inner city. Because when you have people living in the city, their costs go down. So we don't talk, when we talk about housing, we always talk about housing outside. But everywhere in the world, there's housing within the city limits. And it is time we build housing for Jamaican people to live in the city. And we know that the city of Montego Bay falls in the constituency of St. James Central. So a priority of mine is to provide housing inside of the city of Montego Bay. I've already identified a piece of land, and I'm telling you where it is. But I identified, and I identified some people to work with. I don't roll it out here because I don't want nobody to teeth it, but guaranteed it is coming. Alfred, I want to thank you for that. And I know that there are people here with questions because health is everybody's business. I know that Mr. Meredith Rowe has about 3 questions. He has them in his book. And he's waiting to go. I know Reverend Crooks have questions. And I know everybody has questions. Simone, don't worry, your bag is right here. It's taken care of. I know everybody has questions. So, I want to start with the man who is, I don't even have to call it name, Meredith Rowe from Cornwall Gardens, one of the communities built by the People's National Party, just like Rosemont White, just like Cornwall Court, just like how we built, don't forget the one right here, St. Francis Isabella. The people from Railway Garden and Garden, they were relocated by the one father, homes over to Francis Isabella. Farm Heights built by the People's National Party, and we provide settlement and regularization for the people in Rose Heights. We do it already, and we're going to do it again.
First, thank you, Doctor. And I'm hoping that the national campaign, you will be the top 6 or the top 3 speaker. Indeed, because what you have said is most important and very relevant. Yes. And I tell you that if the person who is trying to read will understand what you said, and it's important to impact us, especially with the poorer class of people. Yeah. So, what I want to say, sir, is that dialysis is a critical area, dialysis. And I believe that a real government who care for the poor could find a way even to ask the banks, them who are making billions in profit, to contribute percentage of that profit to put more dialysis machine in the government hospital. Work within in a way of the majority. Cornwall Regional, sir, you hear that noise, the gimmicks that they make. But it's just November gone. They start to work on Cornwall Regional November. Not one whole lot as the minister here, Linkages are saying. Nothing about so. We drive every day, we drive a car, so we drive and look up. As a farmer cop, so we like to look up. That's an area that the party will have to function on. I'm talking about no new tax, not bus, sir. The dollar is so much $150 US to $1 Jamaican. So every time the dollar devalue is cut off in new tax, additional tax. So not the bus. So people sick, not only scholar originals, sir. Sablamar Fallout Hospital have evidence of that. People sick, admit in wheelchair, and some die in wheelchair. There's so many things I could say now. But since your health specialty in the ministry is spokesperson, I will love you to live in sir. So we are concerned, of course, medication is short and a number of occasions. MRI, CT scan, ultrasound, you name it. Poor people cannot afford it. What I can recall, sir, it was under the distinguished patronage of Prime Minister Portia Lucretia Miller that introduced free health care in Jamaica at the government health institutions. And she started with up to 18 years old and maybe to 18 years old and to expand. So we have private mark now, sir, run by politicians. The government chopping them by private mark uptown, up the line. Up the line. So a lot of these things are that I'm sure the party will need to look at. Impact poor people. Finally. It's not in your specialized field, sir. But you see, the talk about the plans of the party, I would advise you to tell the party leader that no manifesto because it can help people like Big Man there. JLP 90 FM. And others. Don't want to say no more. But they can't do nothing. Then it's shall they are political activists. Right. Yeah. The little man on the bottom can't spell degree. Sure. Can't see that. Can't see that, sir. So the party must focus carefully. The majority vote may come from the poor people. Put out a manifesto now, those guys don't brush around it, but you don't mean anything to me as a small man, sir. So the party must cautious as to how you disseminate information. It don't make sense to tell the FM, 90 FM, it don't make sense to give no release to them. It don't make no sense because they twist it up and restructure it. And then I see what make things about Dennis Mendel said in my chopper. And you have bigger chopper now running about the country. Bigger chopper.
You need to give me back that book so we can keep track of everything. You're in good, son. I don't see the book right there. Where we start though? First, coming out of the league, you forget the biggest tax, inflation.
Yes, sir.
Because if you look at GCT alone, if you buy something for $100, you're paying $15. When it gone to $200, you're paying $30. So the biggest tax is inflation. Because you're not doubling your wages when you're doubling the price of something. And we have to remember that. So they're collecting way more taxes. Going to dialysis. Right now, if you have a relative or you need to go on dialysis in the public health sector, you have to wait until somebody on dialysis dies for you to get that space. So you have a lot of patients out there with severe kidney disease and they cannot get on dialysis, and to try and get it done privately, you know, anybody who is working and they can stop working half day for 3 days a week to go and get their treatment, and they can earn enough to have that treatment to pay out over $100,000 a month, then consider themselves fortunate. But the fact of the matter is that the majority of Jamaicans cannot afford that, and because of that, they're being slowly poisoned by their kidneys. To fix dialysis in Jamaica, we have to look at several things. One, you have to decrease the number of patients who are getting chronic kidney disease. And when we look at what is causing chronic kidney disease, is diabetes and high blood pressure. We are seeing the rates of high blood pressure going up, the rates of diabetes going up. About a third of Jamaicans have high blood pressure.
Yes.
Half of those with high blood pressure do not know that they have high blood pressure. So they're walking around with this, what we call a silent killer. And it is damaging their heart. That's how they get the enlarged heart. It's damaging the blood vessels. That's how they get the stroke and the foot giving problems, and it's damaging the kidneys. So the kidneys are slowly being destroyed by high blood pressure. Similarly with diabetes, about 13% of Jamaicans have diabetes. Again, half of those who are diabetic, and even more than those who are pre-diabetic, do not know that they have diabetes.
So they are going around and the diabetes is mashing up the eyes, mashing up the blood vessels, and again mashing up the kidneys.
Yes.
So it is not anybody who they say that you're not taking care of yourselves why you end up in these situations. It is because we are genetically predisposed to getting diabetes and high blood pressure. Once you're a black person on this side of the Atlantic, you're more likely to get high blood pressure than any race anywhere else in the world. And that is because the Africans who came across, our ancestors, those were the ones who could hold on to their salt. And when they hold on to the salt, the water followed it. So all of them who hold on to the salt wood, they made it across and worked on the sugar plantations and became our ancestors. The ones who could not hold on to the salt, they died and were thrown overboard.
Yes.
So they passed on those genes to us to hold on to the salt. So whether or not you like it, you could fit, you could exercise every day, you could sleep well, you could maintain your weight, you still have a factory fault. And that factory fault is that you are prone to have high blood pressure. If we are not screening people and treating them early for diabetes and high blood pressure, we will continue to have chronic diseases being the #1 killer of Jamaicans every year. It is extremely important to find everybody who is diabetic and start treatment before their kidneys mash up. It is extremely important to find every single hypertensive Jamaican and put them on medication, change the diet, cut out the salt, cut out the ackee and saltfish, the corn pork, all of those things. Someone want to laugh?
Yes.
We have to find everybody, screen them, start them on lifestyle changes as well as medication to treat and control the blood pressure and the diabetes. So it is not mashing up the blood vessels, mashing up their eyes, mashing up their kidneys. So long term, we're going to see less people dying of stroke, less heart attack, and less people needing dialysis. That is the long-term goal. You won't see them stealing this idea and implementing it because you cannot put a ribbon for it.
That's right.
But what we hope to do is to expand screening to every single health center across Jamaica. Not just that, but we want to bring it into the homes. So it is not enough to have a community health aide going and visiting someone and say, hey, you never come clinic, make sure you come clinic, behave yourself. You want a community health aide to be trained enough to say that your blood pressure is out, you need to go now. Your sugar is out, you need to go now. That is where we want to bring health and wellness into your homes. We're going to bring it to churches where you have more health fairs, into the community centers where you have a gathering like this. You're supposed to have, if you have a community, a citizens association, just as how you would invite the police to talk about crime, you should have a public health nurse to talk about health.
Yes.
Yes, sir.
And screening ought to be provided. So you can't just say you jump around and you have a public relations campaign and spend millions of dollars talking about know your numbers, and then surprise that nobody still don't know them numbers if you're not providing access to health care. And that is where primary care and access to screening and treatment is going to eventually solve the problem of dialysis, strokes, heart attacks, amputation, blindness. That is what we're going to do. But immediately, there are other options. Before, in my life, before I was a full-time politician, because that's what I am now, there's another way you can get dialysis called peritoneal dialysis, where you have a little tube that you can put in the belly and you just go to the pharmacy and collect your bags of fluid. You run it in the night while you're sleeping, it comes back out, and that is how you filter. You use a natural body chemistry to filter out the toxins. This is something I started to do some work on. And of course, I got sidetracked by representation and politics, but at least I understand the concept, and it is something that I hope that I will be able to introduce as a policy in Jamaica, so that those 100 and odd people who are waiting to get on hemodialysis where you have the blood, they may be able to start, and whoever come along, they may start peritoneal dialysis, and you save lives. So, why I am confident in selling myself as a competent minister of health is that I actually know medicine, I'm not a marketer.
Oh, good.
So I am looking for solutions, and I listen to people. And that is why I'm here listening to you to see what are the concerns.
Yes.
What did I miss? No, got my head not so good. My whole for things that I remember. Manifesto, man, I'm no, that's a party.
I'm telling them. I'm Bradley Avenue.
We're not going in there, sir.
Bradley Avenue.
You know, I'm happy you mentioned about the lifestyle component and our propensity to be afflicted with high blood pressure and so on. One of the things that I've noticed in going across the communities in St. James Central is the absolute need that people have cried out for in terms of recreational spaces. And I know there was this big talk about go out and exercise and all of that. But when you don't have anywhere to exercise, it's kind of hard to exercise. And even in schools, I left Barracks Road Primary School, I won't tell you how long, but a long time ago. And between Barracks Road, Cornwall and Infant School, there's a piece of land in the middle that has not been developed, and by now, the children should not still be running up and down on concrete, and the chance of busting them lip and everything. I reached out to a private sector potential partner to partner with me to develop that area so that the children of those schools where all of your children go, I went there and many go there, can have a proper playing field. It's high time. Farm primary don't have no good playing field. When you look at all the schools across Jamaica, how can this country that produce some of the best athletes in the world, that the majority of the schools, the primary school, the infant schools, don't have proper playing field, proper playing field that could be used by the community on the weekends. We don't have recreational spaces, and sometimes when we talk about recreational space, we think it's only young people need it. The elderly need recreational space too.
Yes.
So these are some of the things that we have to work on, more than just talking about road and water and light, which are important. To build communities, we have to build fulsome communities, including recreational spaces. And that's one of the priorities for me as the Member of Parliament when I become your MP. Reverend Crooks, I know you have a burning question. And you have some too. One from the Reverend, one from the teacher.
Good night, comrades.
Yes.
Before I ask this, I'm going to use something that everybody is familiar with to set on tone what you just said about screening just in mind. Everybody used to love West Indies cricket. Used to world over because we were the best.
Yes.
And one of the reasons that I personally think that we have failed is because we did not create playing field, we did not create training necessary to keep that going.
That's true.
I say that to say this. We rate yourself as the greatest nation on earth in terms of athletics. We soon can't have none because we can't train. And that goes through every structure, every part of the life. So when you speak about screening, please also include schools as part of the screening.
Yes, yes.
Yes, that's true.
Because the bulk of people congregate to and reside in that's your stance.
Yes.
So remember that. Another thing that you raised, and I want to put it a little bit, just a little bit up to high. We talk about centers of excellence, and we usually limit that to education. Cornwall College, where I went, we had that entire plane here, we had leased now. It is there, wasting away in the bush. It's not a whole heap of crime happening there. That's a good place to start a center of excellence for medicine, where you can train people to work on the equipment. We can train the people to do other things, prepare them to go to different, like they come to help people. We can use at a center of excellence. That is one I identified already for St. James. And I think it is very good that you have suggested that, because I was thinking for a long time, we need to have centers of excellence in every parish to promote good health, because that's where it starts. And we could prevent or diminish the amount of sugar and pressure. Because people, as part of our history, it's so now we're going to want to talk about it, but I know it's part of it. Part of the reason why our people suffer with so much of that is because they were slaves, and they used to feed us a diet of corn, pork, and white sugar only. Sugar and pressure. It has become part of our DNA. They did a test where they use some Africans, that's where we come from. On their ranches, they don't have the safety in terms of that. It is a direct result of the slavery. And we can reverse it a little bit if we start at that level, as I mentioned. Thank you.
Thank you very much. I know we have a question here from my teacher.
Yeah.
Come on up.
Yes.
Montego Bay High School.
Definitely. Good afternoon, everyone. Good afternoon, Dr. Dawes. Well, mine is not just a question, but I'm a Michael Magdalene. The ideologies that he had, I still subscribe to. Now, there was something I remember growing up. There were what you would call nurse aides going around in the community. And I find that that was really a good plan, because they would catch some of those illnesses. So they would go to the elderly, babies, they would go to their homes. I don't see that happening anymore. And if we want to say have a developed country, we have to have a productive people. People are healthy, right? And I want to know if that is something that you would want to re-implement, because that is needed, especially in the rural areas, right? Even though they have some clinics around, but there are some persons who will stay at home, don't know their numbers, don't know the illnesses. However, if we have those nurse aides or social workers going around, they will be more comfortable in their homes to subscribe to something like this. So that is one thing I would want to be re-implemented. Now the next thing I have been looking at our hospital here, which was one of the best hospitals in the English-speaking Caribbean. And I'm dismayed to see what is happening to really the only public hospital in our area. And it's a tourist mecca, right? Now I want to know if the PNP is planning to ask for an audit of how much money is being spent and how much money is being spent to pay for the services outside. The services outside the church there, the Adventist church, which provides yes, over by the conference. Has there ever been an audit to see how much money is paid out yearly for that service? Right? So, those are two things that I would want to have the PNP look into. Right?
So to take your first point, my grandfather was a public health inspector, and the public health inspectors in the 50s, 60s, they would be going around and trying to get rid of the chronic diseases that we have. Some of you are old enough to remember yaws and TB and those things being a problem. Even polio. We were one of the first countries, if not the first country in the West, to get rid of polio, and it was because of the exemplary work of my grandfather and other public health inspectors. So once we transitioned from a country that the population was dying from a lot of tropical diseases, infectious diseases, we moved into other things like we want to look at maternal health. And I must just segue to say that it is really terrible that the death rate for mothers now is higher than it was 30 years ago. And it is just like a sign of a failure of provision of services, because the buildings are better than 30 years ago. But the discussion, I don't know much, I didn't delve into it too much when I said that we have to bring screening into homes. We have the community health aides, who are basically what's left of Mike and Manley's nurses aides, who used to go into the homes. But all they're doing is just checking people to see if they're all right and if the wilderness clinic. We want to retrain them the way the nurses aides were trained, so that when they're going into the homes, they're going in with their pulse oximeter to check your oxygen. They're going in with their blood pressure cuff to check your pressure. They're going with the pig pricking to check your sugar. And they can tell if you're a diabetic and it is out that you need to go in. And that if you are a non-diabetic, that is how we're going to pick up. Or you think that you're a non-diabetic, that is how we're going to pick up. Whether or not you have the disease or high blood pressure and so on. So when we speak about primary care reform, the clinics are just going to be a forward base where we can project the community health aides who are trained, the way the nurses aides who are trained in centers, to go into the homes of the most vulnerable and bring help to them upstairs. So the plans are afoot, and I'm very happy that just being here and hearing you suggest it means that we are on the right track in that thinking. Yeah. With respect to Cornwall Regional, looking at the site today, it is as if construction just began. We know that the contract was signed recently for the new contractor, and actual work began about 6 months ago. So I agree that not much work was being done before. The question is, where did the billions of dollars go? If after all of that spent, we are at the point where it is a shell of a building just being outfitted with the electricals and drywall and so on. We have lost billions of dollars that could have gone towards renovating other structures, as well as providing health care, putting in CT scan machines, radiology units all over the island. So it is a tremendous opportunity cost that we are bearing as taxpayers, outside of the people who have died because of the lack of provision of services. I believe that an audit is necessary, yes, so that we know if there are persons who unlawfully benefited from the misery of Jamaicans, to
through the theft of taxpayer dollars. And so it is going to be one of the things that we're looking into to see if an audit of the Cornwall Regional Hospital renovations is warranted when we assume office.
Okay, let me make it easier and take the microphone to you, right?
We are all talking about national public, and it's a cause of I've been in hospital since 1967. The father is covering, but it took the first copy in 1972. And mom was those. Oh, okay. All right. And just to echo this our educator here, I also consider myself a man about the baby, that I was one of the first beneficiaries of the free education of covered insurance. And what that has instilled in me is a sense that what I have received I should give back. It was not free this to me. It was an investment in the future. And any from my generation can attest, and we have been given that sense of mission that we should give back to the country whatever field that we find ourselves qualified to do. I just want to acknowledge what you said, Dr. Dawes, about the territorial benefit. But unfortunately, my son is a kidney patient, and he has been using that for over 2 years now. And I go every week. To the pharmacy and collect the fluids, and I always give that time. And I am always so very proud of the pharmacy and pharmacy technician over there. And it makes me feel good to know that that was coming out about the part of the people that are part. The job, what was the name of the National Health? Yes, National Health. I remember how hard time we got. We had beginning that fast until my realized how this is now. And it's spending money in the private center from the phone. That is not good. I hope I can get out of deviate doctor from since Cornwall added the spokesperson for tourism. Something in tourism that has bothered me for many years. I remember in the 90s when we started the highway system. And from that came the hotels on the North Coast. And I was always very enthused and very happy to hear about the thousands of hotels being built and how great an effect that's going to have on Jamaica's economy, how it's going to grow, because we have freed up the rights land after people try to quiet it as some type of corrupt agreement. But what it was free up all those land and try to tell them in court so we could have them. For development, the first one was on the Ritz-Carlton, and so many have come up for that. And subsequent administrations have continued to announcements. Yesterday there was it was Cedar strategies. It was strategies to the big year. I don't know if he got a Cedar strategies, not those strategies that are that doesn't sound like even some more money, I'm sure. But he was announcing 2 new hotels for St. Anne. But then, the hotels have come. You have an employment. But the country doesn't grow. Exactly. And when we had people that are protesting about lack of pay, the government going in and talking about management not treating people to that. But we all know the problem is that we have, and with this as a lifelong program, I think my partners and my partners at fault. We have been a part of it, I think, in marketing Jamaica as a low income, low pay jurisdiction. And I really think at this time we started to exercise our brains as how can we attract higher paid investment in the country that can really grow the economy. Because if the people are all employed at minimum wage, just above poverty level, that cannot grow the country better. Because where is the money to be spent to grow the economy? So we can have business. I can invest to send my child to college to better my family and so on. It's really for the mic, so they know what to do now. But my question is, what plans, and it's clear that you cover that is for the spokesperson for tourism, what plan is there to attract higher paying jobs in the tourism industry? Just like Barbados, Bahamas, they're not all hooked on this all-inclusive thing. Why can't we attract European plan hotels in Jamaica? Both my parents were employed in European plan. And they tell me that, they said, my father said to me, boy, Daphne, this year, when season comes, we get saved. And the next year they put me in their house.
Yes, that's true.
Because I remember when season came, when my mother, as a chambermaid was coming, now there's a guy housekeeping. As a chambermaid, when the billionaires come from America for the 2 weeks stay, she doesn't touch her kid. No. And the hotel would have been taken out at 10%. Because I heard what they leaving that with it to her. We want to, I would love to see where we can attract that type of investment and get away from all inclusive.
The points that you have raised are points that I have raised in the Senate and will ensure that we work on. As a matter of fact, I'm having a discussion just tomorrow with our spokesperson on finance, Julian Robinson, to discuss some of the plans that the People's National Party will seek to implement as it relates to tourism. What I will say to you is that two things. One, treatment of workers must be based on some basic minimums that are without question and non-negotiable. When we have investors, when we attract investors to our country, there are some things that we must ensure are basic minimums. The fact that you had workers protesting in recent times, it shows you how far things got. Because you know that we know how to suck salt through wooden spoon and take it until it reaches a point when you can't take it no more. The development of our tourism product at a point in time when we needed to increase our room stock so that we could grow, like you said, from the freeing up of those Rollins land, and we had the hotels like Ritz-Carlton and Iberia Star and others. We had to go in that direction to seek to expand the industry in order to gain more. However, we are at a point in time now where we must do a stop and assess how much more of that type of investment should we be willing to take on. Because my grandmother was a chambermaid. I know what when they talk about season, I understand it. Because many people here in Montego Bay knew what it meant when season comes. Because you were guaranteed to see a certain level of business. And that came from a certain type of product, the European plan product, where people, you go to a hotel, you stay there, sleep there, but you experience everything else on the outside. Now we have become a little bit, not a little, heavily focused on the all-inclusive. I am not knocking it, but we must at this point assess whether or not we should change the ratio and establish a ratio that will allow for the development of other types of products to allow for the dollar, the tourism dollar, to go further than it is going now. Right now, under 40 cents of every dollar that is earned in tourism, that's all that is retained in Jamaica. Under 40 cents. We have to get to a place of at least 60 cents. That is when you know that more Jamaicans are truly feeling the tourism dollar. And yes, tourism, as a matter of fact, tourism may seem to be doing well, but you and I, who used to develop or feel it more, my parents operated restaurants in Montego Bay that benefited from tourism business. We are not feeling it as we used to. The transport providers are not feeling it as they used to. And that is why we believe that we must protect certain areas of services that are beneficial to tourism, so that there are Jamaican businesses that own and operate them, because we have to retain more of the dollar in Jamaica. So you and I are on the same page. Okay, and this is a priority of the next People's National Party government when we come back to office.
Good evening, everyone.
Good evening.
Okay, it is really a pleasure to be here. Usually I shy away from this forum, but I'm happy I am here. I want to mention that some years ago, my partner and some friends, we started Rosemont Gardens Football Club, and we were involved in other football clubs as well. And I want to mention that most of the young men, they were from some inner city communities, and especially from the Rose Heights, which, you know, they're termed as a bad area. And I remember we usually get most discipline every year. Most discipline. So I'm saying that the potential is there for us to develop our youth. So what I want to find out, what is it that is going to be in place for youth development, especially for the young men? As I noticed that most of the fields nowadays, they are occupied by military base. And that is just a new for me, and I'm really, really concerned, as I said, especially for the young men. And this goes on, whenever they are injured, they're going to be taken to the hospital as well. So it's a domino effect. And so, what are the plans for youth development?
I'm happy that you raised that. And I remember having a conversation with your partner, Ishmael, about the importance of not just sports and recreational activities to rebuild communities, but there's also music. Farm Heights, Rose Heights had a great marching band going. I know in Rosemont, they recently, there was a member of the community in Rosemont, one of the oldest communities here in Montego Bay, again, built by People's National Party. When I had a conversation a week ago on Ash Wednesday with some people, young men who were flying kites in the community, and I stopped and talking to them, they told me of some equipment that a member of the community who has since passed worked to acquire by partnering with somebody overseas to send them here to Jamaica. And just because of clearance and your people over at customs, because of that they were not able to get the equipment in hand. And when I asked the young men, what is the thing that you would want most in the community? And he says, sporting or music program for the youth. Every community that I have gone to, this is what they have said, but here's what we're going to do together. Me as your member of parliament, working with you, the members of the community, whether it is Rosemont Garden, Rose Heights, Farm Heights, Greenpond, Cornwall Court, wherever you are, I, as your chief advocate, will work with you to redevelop these, because it is through these programs with the youth that we're going to be able to recapture our communities. So, me and you do this. It's not me alone, and it's not you alone, it's us together that we're going to do it. And it is achievable, because you want a champion, I'm your champion. Alright? Yes, guys. This will wrap up so that we can send home Dr. Dawes and his team.
Come on, Jenny.
Yes.
I was going to say much, but since you touched on the music,
Yes.
I know the heart is in your blood. I know that when it comes to music and so forth,
Yes.
it's in your blood. Now listen, in the hotel business today, the entertainers are suffering.
Yes, yes.
Most of them can't go by a car. They have to take taxi and double fare and so catch them. Right? Musician is supposed to be top class, well paid. Just a week or so, the biggest youth choir in the world, 10,000 youths, where they have singing Bob Marley all over the world, and we don't respect that. He's the greatest artist that ever come on planet Earth. None before him and none after. And we take this music business, entertainment business, like this joke. So the big artists, them in Kingston and all that, and then come here, they pay them, they president them, they negotiate them, US dollars, and all of that. And the hotel people, you know, this is a Spanish man, almost a band. The guys them play, but they don't want the business. They just pay for $4,000 or $5,000 a night. See, I hear they have over $3 million worth at my house. Well, next door gave a story that not a marching band, but pop band. I mean, not, I swear to God, I'm not going to work for them kind of money. So we're going to work for them guys. They can't retire or they can't live. They're telling the truth, Robert Janice. We can make 100 release people around the restaurant where you know me eat a morning time. We have to fight people. We get quarrel sometimes. A man named dancing people there. We have to fight with him, the great and all musicians. And some musicians come that I want to tell you because you know, dress good. Because we don't pay them so yes, I'm so happy that you touch and that because I know the art and music.
Yes, Comrade Brano, you're right. And that is an area that we must focus on in going forward. I was about to say comrades, but I will say friends. Citizens of the communities in and around Mount Salem. The issue, or the issues, Comrade Kerry, the issues that we are discussing this evening are issues that every citizen find important, and that is why we are having these discussions. So if it was 5 of us or 1,000 of us, we're having the conversation because it's important to be had. If we intend to represent you, we have to hear from you. It's not about us coming and saying, I saw it must go. That type of representation is not what we're about. We are about dialogue, partnership, communication, championing on your behalf, being your chief advocate, ensuring that you hold us accountable.
We're on. Yeah? Okay. Dr. Alfred Dawes, opposition spokesman on health and wellness.
Yes, you mentioned about medical marijuana. Can you elaborate more on that?
Well, the Cannabis Licensing Authority has pretty much regulated medical marijuana into the ground. There's no industry, and coupled with that, the regulatory framework governing studies that would validate some of these claims that are being made by companies developing different strains is just non-existent. The fact of the matter is that the Ministry of Health has in place a system whereby if you want to conduct clinical studies, it is very tedious and cumbersome. It kills innovation, and one of the things that has resulted in is that a lot of the strains and a lot of the products developed from medical cannabis, they are just non-functional because they cannot go out into the market where it is needed. I personally have an example where I've worked with a company whereby a particular Sorry, tell me when I can start back again.
You can continue.
Back? I personally have worked with a company whereby a product was developed, but then we just do not have the legislative framework, or at very minimum, the Ministry of Health cannot have the approvals of a clinical study for us to bring this product, which has been shown in preliminary studies to be effective in fighting colon cancer. So Jamaicans are going to continue to languish with no options available when the traditional Western therapies have failed, when we do have here on the island medical marijuana products that can offer some hope for families and for patients who have cancer. Outside of that, there are other products that have been identified that may help with different diseases, and they just cannot come to market because of the regulatory framework that just does not exist. And until we get the reform of the framework governing the clinical studies involving different treatments, not just medical marijuana, but alternative treatments to Western therapy, we're going to always be lagging, and our people will not get the benefits of the innovations here in Jamaica.
Yes, and you also elaborate about the tour of Cornwall Regional Hospital. Could you give me an update on where Cornwall Regional Hospital is here at now? The status of it now?
I think that Cornwall Regional Hospital, having seen the current structure, which is a shell, and the plans that are in place to bring it to completion, I believe that it is going to be finished at some point in time in the near future, maybe next year, maybe the middle or end of next year. The issue that I have is that with billions of dollars spent, where did that money go before we had serious work taking place in the last 6 months? That is a question that must be answered, because the Jamaican taxpayers have borne a significant opportunity cost with billions of dollars that could have been spent on upgrading other facilities, outfitting every hospital in Jamaica with a CT scan, an ultrasound, and a working X-ray unit, as well as maintaining those units. We missed out on that because of the cost overruns at Cornwall Regional Hospital. We're seeing a construction site right now that is primed for a brand new building, but at what cost did we get here? And who is to blame for it?
All right. Thank you very much.
All right.